factors in gestational diabetes. Stay tuned. Hi everyone, welcome back to Kashi's Corner. If you are pregnant or planning to become pregnant and you have heard the term gestational diabetes floating around, you are not alone. It is a condition that surprises many expectant mothers, but knowledge is power. In today's video, we are delving deep into the risk factors for gestational diabetes. What causes it? Who is more likely to get it? How your background and lifestyle plays a role, and what you can do to lower your risk. So if you are ready to take charge of your health and your baby's health, grab a pen, get comfortable, let's go. What is gestational diabetes? Before we explore risk factors, let's first define what gestational diabetes is. Gestational diabetes, or GDM, is a type of diabetes that develops during pregnancy, typically in the second or third trimester. It is different from type 1 or type 2 diabetes because it usually goes away after the baby is born. However, it can have serious consequences for both mother and baby if not managed properly. How does it happen? During pregnancy, the placenta produces hormones that make your body less responsive to insulin. To compensate, your pancreas produces more insulin, but sometimes it is not enough. As a result, glucose builds up in your bloodstream, leading to high blood sugar. Why does it matter? It matters because it can cause your baby to grow too large. That is macrosomia. Increased risk of C-section, cesarean section. Higher chance of preterm labor or preeclampsia. Long-term risk of developing type 2 diabetes for both you and the child. Part 3. Non-modifiable risk factors. Non-modifiable risk factors. That is the risk you cannot change. Now that we understand what gestational diabetes is, let's break down the non-modifiable risk factors, things you can't change but absolutely need to be aware of. Number 1 is age. Women over 25 are at slightly higher risk. Risk significantly increases after age 35 and even more after 40. Why? As we age, insulin sensitivity naturally decreases. But don't panic. If you are 35 or older, many women have healthy pregnancies. It just means you will need to be extra proactive. Number 2 is ethnicity. Certain ethnic groups are genetically more prone to insulin resistance. For instance, African, Native American, South Asian, Pacific Islander. This is not about blame. It is about biology. These groups tend to have higher baseline insulin resistance and should be tested early in pregnancy. 3. Family history of diabetes. If a parent or sibling has type 2 diabetes, your risk increases. Family history may signal inherited insulin resistance. Even if your mom never had gestational diabetes, her having type 2 diabetes can still put you at risk. 4. Personal history of gestational diabetes. If you had it in a previous pregnancy, there is 35 to 60% chance it will reoccur. This makes early testing in future pregnancies essential. Number 5, history of polycystic ovary syndrome, PCOS. PCOS is associated with insulin resistance and metabolic issues. Women with PCOS are more likely to develop gestational diabetes. Previous macrosomic baby. If your last baby weighed over 9 pounds, that is 4 kg, it could signal undiagnosed gestational diabetes. This increases your risk in future pregnancies. Unexplained stillbirth. History of unexplained pregnancy loss may also be linked to glucose control issues. Part 4. Modifiable risk factors. Let us move into the modifiable risk factors, the things you can influence before or during pregnancy. Number 1, overweight or obesity. Overweight or obesity. A BMI, that is body mass index, over 25 is considered overweight, and over 30 is obese. Higher body fat increases insulin resistance. Even modest weight loss before pregnancy, just 5 to 10% of your body weight, can significantly lower your risk. Number 2, sedentary lifestyle. Physical inactivity makes your body less sensitive to insulin. 30 minutes of moderate activity per day can improve insulin response. Poor diet. Diets high in refined carbs, white bread, pastries, etc. Sugary drinks, processed foods, increases your blood sugar spikes. Focus on whole grains, vegetables, lean protein, and fiber-rich foods. Rapid weight gain during pregnancy. Gaining too much too fast in the first or second trimester increases risk. Follow your doctor's recommendations for healthy weight gain. Smoking. Nicotine affects insulin sensitivity, increases the chance of both gestational diabetes and preterm labor. Sleep disorders. Lack of sleep or conditions like sleep apnea can worsen insulin resistance. Part 5. Risk factors compounding each other. Some factors spikes others. Keep in mind, these factors don't exist in isolation. One risk factor may amplify another. For example, a 35-year-old woman with PCOS and a high BMI, or an African woman with a family history of diabetes and sedentary lifestyle. This is why early screening is crucial. If you have any combination of these risk factors. Screening for gestational diabetes. When should you be screened? Between 24 to 28 weeks of pregnancy. Some may be screened earlier if at higher risk. Don't skip this test. Early detection leads to better outcomes. Part 7. How to lower your risk. If you have risk factors, it doesn't mean you are guaranteed to get gestational diabetes, but it means prevention and planning becomes key. Before pregnancy, lose excess weight. Improve your diet. Start exercising. Treat PCOS. Quit smoking. During pregnancy, stick to a healthy eating plan. Monitor weight gain. Stay active. Go to prenatal visits. Consider early glucose testing. Part 8. Mental health and stigma. Let us also address the emotional side. Many women feel guilt or shame when diagnosed. I want you to know that you didn't fail. You didn't do anything wrong. Your body is just reacting to pregnancy in a certain way. With the right support, gestational diabetes is manageable and your baby can be perfectly healthy. Part 9. I have some frequently asked questions to answer. Number one question says, can thin women get gestational diabetes? The answer is yes. Genetics, age, and PCOS can play a role in that. Question 2, can it go away before delivery? Rarely. Usually, it stays until delivery, then disappears. Question 3, will I have diabetes for life? Not necessarily, but your risk for type 2 diabetes later is higher. Question 4, can I prevent it in my next pregnancy? Weight management, exercise, and early screening helps. In conclusion, gestational diabetes may be common, but it's also controllable. Knowing your risk factors empowers you to take action. Don't wait until you are pregnant to care about your blood sugar. Your health and your baby's health deserve your attention now. If this video helped you, please share it with a friend, a sister, co-worker. Let's spread awareness and make maternal health a priority. See you in my next video.